Good morning. Welcome to Coffee and Vulvas. This is my second one for this week. Super excited to be here. I am again drinking my Nespresso out of my Big Boss Lady mug. I love it, with some half and half today. I am sitting outside enjoying the weather because here in Florida it's actually really nice in the mornings right now, and I'm spending a lot of time in gratitude, just being really thankful that I have a space to kind of come out and just relax for a minute, because grounding is so important. That's not what I want to talk about. I really want to talk about my mission, and I know I posted a story yesterday on Instagram and on my Facebook about who I am, a reintroduction into why I do what I do, and I always get some amazing questions from it. And someone had reached out personally and had asked me, like, why I chose to work with postpartum women, and I'm not postpartum. And I just wanted to share with you that just because I haven't had children does not make me less equipped to being able to treat you. It absolutely does not change the ability of mine and like the expertise that I have, the education that I've done in order to help you through that. Will I understand the emotional and physical side of giving birth? Maybe not as much, but that does not equip me less than someone who has had children, because I've worked very hard to become an expert in this field, and I've worked incredibly hard to be able to know the answers to your questions and to know how to support you the best that I absolutely can. And I think that that's, you know, goes to be said for, right? Like, I think that that's something that we all need to understand. I think that that's something that we should talk about more, are the amazing professionals out there that are doing things that we haven't experienced. Because I ask people all the time, like, as a physical therapist, I've never had a rotator cuff surgery, I've never had a hip surgery, I've never had a knee replacement, and I treat them all the time very successfully. And so, or I did treat them, I don't anymore in my practice, but I used to treat them all the time. And so I don't think that that is a good way to determine whether or not we are equipped to help you or not. I really think it depends on a couple of factors, one of which it does depend on character. When you're looking for a clinician, is your clinician trying to connect with you on a personal level? Are they trying to care about you? Are they trying to reach you on a deep level and be connected and be friends and build a relationship? Or are they just using you for money? Because you don't want someone who is not actually passionate about what they do, and you don't want someone who's just there to make the buck, right? And that's a big thing in professions all in general, and I hear it all the time in the chiropractic world as well as the physical therapy world and the massage therapy world, where clients feel like they're not getting heard. And I think that it's really important that you find a clinician that 100% hears you and tries to get to know you on a personal level. I know my clients, I know how many kids they have, I know if they have a spouse, I know where they live, I know things like that. Their birthday is always listed. It's just important to understand how all of those things work and how that happens. So I think it's important to find a character in your physical therapist or your birth professional, whoever it is. Make sure you connect to them, and then ask them their why. Ask them why they treat women like you, or ask them why they treat clients like you. What is it about that diagnosis that makes them want to see you? Because you all, like, my women who are postpartum, pregnant and postpartum, like, it is my whole heart, and I will bend over backwards to make sure I figure out the answers for you, because it is what I love to do, and it's just what gives me joy. It's what I believe God put me here for, and it's what I'm supposed to be spending my time learning more about and educating people on. And I am the one that's supposed to be creating this movement, and I know that. And I think it's important that you find someone who actually has a passion for what they're doing, because you will get better care if you do. I hope that helps you guys kind of clarify where I'm coming from and all of that good stuff. And I think that it's just really important to know your clinician and to know your provider, and to care enough to reach out and make sure that they care enough about you, because you want to be sure that you're picking somebody who's actually on your side and not somebody who's just there because they have to be. So find a good provider, find their character, know their passion, and then you can go from there.